Clare Daly.
Thanks, Ceann Comhairle. I'd like to thank Sinn Féin for the opportunity to discuss what is obviously an incredibly timely and very necessary motion. And I'd have to say that if we don't address its content, then the crisis in our health service is going to be accelerated. We all know how important the role of nurses are in our society. Now, I am not going to reiterate those points and patronise those people, because what they don't want is a pat on the head. What they actually need is a reversal of the policies of austerity, which have been to no one's benefit since 2012. And it was a bit ironic listening to the former Labour Party minister, who was part of that process, telling us now how it was all so wrong. But the point has to be made now. If you're not concerned at the personal cost on individual nurses, you should be concerned about the impact that it's having on our health service, because the motion correctly points out the correlation between the decrease in staffing levels and the increase in workload, which has a huge strain on the service and those working on it, and all of us who need to access a hospital. We know the Commission on Nurses' Pay is due to publish recommendations in June, and that the Commission has to be cognisant of the strain that the nursing profession has been under since 2012 and has to take steps to reverse this damage. I think the recruitment embargo and the decision to reduce the starting salaries of graduate nurses and midwives undoubtedly has had a massively negative effect on recruitment and retention, and the continued failure to address it means that the profession has become attractive. It's an incredibly big ask to expect somebody to be a nurse, which is a hugely demanding job, against the backdrop of an average industrial wage of $37,000 with a starting salary of $28,600. When you couldn't rent a room or get your children into childcare in this city on wages of that level. Now, we know the INMO highlighted this year that there's been an aggressive recruitment of Irish nurses by UK hospitals, and that the HSE is not competing when it comes to pay and conditions. So what we have is the education of these individuals being funded by the Irish taxpayer, and that being handed over to hospitals in the UK. Probably just as well that they have to look after many of our women who we send over there for treatment as well, but that's a different story. But at the same time, as Irish nurses consider leaving for better wages elsewhere, we're left with two serious consequences: the inflow of nursing staff from other countries and the outsourcing of work to agency staff at higher costs. Now, the inflow of nurses from other countries, generally from developing countries, has had an impact on those countries of origin, in that those countries lose the skills to this country, where we have a highly trained workforce and shouldn't have a shortage of medical staff. Now, this is appalling. It's a practice that's shunned by the International Labour Organization because it creates a brain drain in some of the poorest countries in the world who need it most. We also have the truly wasteful policy of outsourcing and the new buzzword of self-employment in the HSE at higher costs. This is an overall pattern. We now have 1 in 5 in education on temporary contracts. This has been replicated in the health sector. And the self-employment category, this mythical self-employed, where 1 in 10 workers in health and social work are now in the category of self-employment. This is absolutely appalling afterwards. These are professional occupations which are being pushed into the category of insecure work. If we don't address it now, it's going to have an impact on our health service even greater than it has already, not to mind the enormous cost on those individuals who take on that work.